based on this thing that made the nationwide news: does fish oil increase one's risk of getting prostate cancer? And this study was done by Crystal. So there was a 71% increased risk of prostate cancer with high intake of omega-3 fatty acids. He suggests it might be due to oxidation of the fish oil. Another possibility would be contamination of the fish with pesticides, because they actually did a study where they gave animals contaminated salmon and they all developed diabetic conditions and things, and when they had a non-contaminated fish oil, there was just an improvement in health. What about the study? Well, first of all, he didn't adjust for any known risk factors, including ethnicity, PSA level, age, body mass index. There was merely an association in the study. Our previous epidemiologic studies demonstrate no correlation between omega-3 intake and prostate cancer. As a matter of fact, the opposite. There's a number of studies that show that the fish oils actually reduce the risk of prostate cancer. They used plasma levels in this study, which is a poor indicator of long-term intake. And the researchers were quick to blame fish oil supplements, although there was no indication anybody in the study was taking fish oil supplements. Brasky himself said it's important to note that these results do not address the question of whether omega-3s play a detrimental role in prostate cancer prognosis. So that's from the lead author himself. This is kind of one of those situations of what I call the dog bites the man. You can have 100 studies that show that the fish oils reduce the risk of prostate cancer, but you get one that shows the opposite side. That's newsworthy, because people will read that. So I've put a couple other studies up here. Here's one by Nourish: Prostate Cancer Risk and Consumption of Fish Oils, a dietary biomarker-based case control study. They point out that it's very difficult to assess dietary intake. They examined the relationship between red blood cell levels of EPA and DHA and prostate cancer risk in a case control study. They found if the EPA levels were elevated, the prostate cancer risk was about 60% of what it would be if the EPA levels were low. Pretty much the same with DHA levels. So that's one study. Here's another. They looked at 6,272 Swedish men. The men who ate no fish had a 2 to 3-fold higher frequency of developing prostate cancer compared to those who had a low fish intake. Another study by Harvard, they looked at 47,000 men for 12 years, doing a dietary intake analysis every 4 years. They found each 500 milligram of omega-3 fatty acids the men got from eating fish was associated with a 24% decreased risk of metastatic cancer. That's that.